Had all of this set. Okay, share. Okay. So today's topic is putting people first. I am not a nurse, so we have a professional here, Ms. Woods, for that part. But I am a community advocate. I've been serving in this capacity a little bit over 15 years at Family Service. This topic is near and dear to my heart because HIV not only affects the person who's diagnosed, but it affects everyone, family members, moms, dads. It's personally, just to personally disclose, I have family members who have succumbed to the virus, and I have family and friends who are personally infected, who persons are living with HIV and AIDS. So this is near and dear to my heart. I just want to make sure that those individuals are healthy, not stigmatized, and live a full and happy life. So today, the information that I'm presenting on is basically from the Louisiana Health Hub, the LDH, Louisiana Department of Health. And this is just a disclaimer, is basically stating that I did not just come up with this information. These are Louisiana statistics. It goes back to 2021. So I'll just start on the HIV annual summary. So Louisiana does an annual summary that goes back 2 years. So the last summary came out December. The last summary rolled out December 2024, but it went back to December 2021. And so with that statistic, so the annual statistics, it reflects that there were 182 newly diagnosed individuals in the state of Louisiana. And that was a total of 934 individuals diagnosed. The diagnosis rates were 26.6 and is at 100,000 population. Louisiana ranked second in newly diagnosed state. So we ranked second with individuals who are newly diagnosed in the 9 public health regions. So Louisiana. I'm sorry, Baton Rouge ranked number 2. So in the 9 public health regions. So it's not only Baton Rouge, but Baton Rouge and the 7 surrounding parishes. So if you take a look at this chart, it basically reflects that African Americans are leading in the newly diagnosed rates of HIV and AIDS. Out of the majority of diagnoses, 75% were among African Americans, Black people. So 79% were newly diagnosed. Hispanics led at 9%, white led at 11%, and 1 was other. Now, out of that 79%, if you move over, males comprise 79% of the newly diagnosed individuals. And out of that 79%, you have that 20% of African American females and 1% of transgender females. And if we're looking at, we'll move over to the chart, looking at the age of diagnoses. In 2021, the ages of 20 to 29 had the highest rate reflected at 73 individuals that tested positive that were counted in the state statistics. Now, many of us feel like, hey, we're over the teenage years. I'm married. Oh, I'm in a monogamous relationship, but that don't really mean anything. So if you look at the newly diagnosed as well, leading behind that, people who are 30 to 39-year-olds have 43 newly diagnoses, 40 to 49, 20, and 50 plus 32 newly diagnosed individuals tested positive in Baton Rouge. In the Baton Rouge, the metropolitan statistical area ranked 7. Ranked 7, and New Orleans ranked 9 for new HIV cases. Baton Rouge and New Orleans are the large metropolitan areas in our state. So moving along to quarterly statistics. So the state does do quarterly statistics as well. And in the first quarter of 2024, 23,126 persons are currently living with HIV/AIDS in Louisiana. And this is state statistics, and this is the first quarter. The number of persons living with HIV is 12,157, and the number of persons living with AIDS, 10,969 people are living with AIDS. So it just shows you that if you're, just for instance, if you are going down the street, statistically, every third, and if you're looking at homes, every third home, a person is diagnosed with either HIV or AIDS. So it just shows you that it is a large, we are impacted in a large way. So people living with HIV in the Metro Baton Rouge area for the first quarter statistics of March 31st, 2024, out of those regions, Ascension, EBR, East Feliciana, Iberville, Livingston, Point St. Helena, West Baton Rouge, and West Feliciana parishes. Out of those individuals, 5,538 people are currently living with HIV in the Metro Baton Rouge area. And number of people living with HIV in Baton Rouge and the 7 surrounding parishes, 2,893 individuals, and AIDS diagnosis, 2,645. And if you want to break it down to gender, the percentages, and men is 3,519 individuals, and women, 1,927 individuals. And for trans women, 89 newly diagnosed in Metro Baton Rouge, and trans men, 3. So the top 4 parishes of people living with HIV and AIDS as of March 31st, 2024, Orleans Parish, East Baton Rouge Parish, Jefferson Parish, and Cato Parish. Who's most affected? Well, everyone's really affected, but who's most affected? Gay, bisexual males, trans females, women of color, meaning African American, and Latinx females. Nationally, every 35 minutes, an African American woman tests positive for HIV, and that is alarming. Even though we're out there, we're grassroots, we have much education, billboards, commercials, all the new leading advances of medications, PrEP to prevent HIV, we are still testing positive. So that is telling us that something is not connecting. We're going back to the drawing boards, figuring out what are we not doing, because we are still testing positive at an alarming rate. So it's just saying that we have more need for education, prevention measures, and just basically as women taking care of ourselves, talking to our partners. Hey, before we engage in any sexual relationships, get tested together. Just don't let them bring you a test and say, hey, I'm nothing's wrong with me, or I'm not positive. Get tested together. Make that as a way of first before your sexual encounter, so you guys can both be on the same field. And if the person is positive and you want to engage in that relationship, talk about getting on PrEP. And I'll go into PrEP a little bit in the slide. Black women and HIV, according to the Center for Disease Control in 2022, 91% of new infections were attributed to heterosexual contact, while the HIV infection rate among Black women were the highest compared to women of all other races and ethnicities. African American women are disproportionately affected by the HIV epidemic in the United States. African American women are being diagnosed between the ages of 24 to 35 years of age. So if you have daughters, sisters, nieces, these conversations need to be had. The primary risk factors for people newly diagnosed with HIV in Louisiana are gay, bisexual males, and other men who have sex with men. So we all know that relationships come in so many ways. It's just not heterosexual relationships. It's just not gay relationships. Relationships can look any type of way, whether it's combined, heterosexual, polyamorous. It is just very important that conversations are had about sexual experiences, about diagnosis, about being positive. Black people in Louisiana experience severe health disparities in regards to HIV and STDs. Um, and we are still in Louisiana, still trying to fight to get in some of the local schools to have those education conversations with our teenagers, with our school age kids. And some schools have been open and some schools are still resistant because there's a lot of ethical boundaries around HIV and AIDS and testing and medical information. As of March 31st, 2024, 59% of early syphilis cases were reported. So, and this is another conjunction with HIV. People who are testing positive are also coming along with a positive syphilis test. So we are seeing a rise in new syphilis cases as well. So folks shouldn't just worry about HIV. Syphilis is on the rise as well. Community impact. In February 2019, the National HIV Strategy for the United States termed Ending the Epidemic. This provides stakeholders across the nation with a roadmap to accelerate efforts to end the HIV epidemic in the country by 2030, meaning no new transmissions. Our former mayor, EBR Mayor President Sharon Weston Broom, in 2018, the former mayor of EBR Parish joined the International Association of Providers of AIDS Care by signing the Paris Declaration of a Fast Track City. Joining the Fast Track City solidified the local government's commitment to address the HIV epidemic in Baton Rouge, such as funding efforts, more funding for research, more funding for education. And as a Fast Track City, one of the main goals were to do opt-out testing. So, meaning that when you go to get tested at your doctor's office, when you go to get tested in the some folks still get tested in the emergency room or now urgent cares, our local community health organizations. Um, they're supposed to ask you, do you want to test? A lot of folks, when they go to the doctor, they did not ask that. A lot of providers do not ask that. It's still taboo with some providers in 2024. So, ladies, just make that a part of your routine care when you go and get your annual. Hey, can I get tested for everything? Not only just for cancer, not only for just doing my pap smear, but just get tested for HIV and other STDs as well. The ending the epidemic strategic goals were to prevent new infections, improve HIV-related health outcomes of people living with HIV and AIDS, reduce health-related disparities and health inequities, because not only when you're coming in, when our folks are coming in positive, they're just not coming in positive to say I'm HIV positive. They're coming in, it's scarce of food, they have no food, no housing, low income. They're coming in with a whole slew of other issues that prevent them from becoming healthy. Achieve integrated, coordinated efforts that address the HIV epidemic among all partners and stakeholders. And so I can say that, and not being biased because I work in Baton Rouge, but we do a good job as a TGA to ensure that clients are not only just seeing the doctor, but they are being virally suppressed. They are taking their medication. They are going to the doctor. And they are talking to their partners if they are not positive about PrEP and about education and other prevention measures. Combating internalized stigma of HIV and AIDS, empowering steps. So some things that we can think about: challenge your negative beliefs about yourself. Are they really true? Take your HIV medication as prescribed for undetectable viral loads, keeping yourself healthy and protecting your partner. Seek a counselor to navigate thoughts and feelings about your HIV status, and join support groups and organizations as a safe place to overcome those challenges. So if you do have any friends or any family members or someone that you may love who is positive and they don't know where to start, not being biased to family service, but you can call family service. But there are other community health organizations to get them on the right track that provide support group and support just to say, hey, although you're positive, this is not a death sentence. This is not Philadelphia. This is not 1980. You can live a long, healthy life. So prevention measures, get tested regularly and get tested together. Protect yourself. HIV and the law. Safe sex practices, abstinence, condoms, clean needles, PrEP, and disclosure. Talk to your partner. Communication is a big thing. Communication is actually a prevention measure. Don't share needles. Don't share needles for drug users. PrEP medication is medication that you can take to reduce the transmission of HIV. Decrease exposure to PrEP. Decrease exposure to PrEP. PrEP is for people who don't have HIV but are at an increased risk of contracting the virus through sex or injections, drug use, and educate yourself. And these are some partner organizations in the Ryan White TGA, Family Service, Care South, Open Health, Our Lady of the Lake, Volunteer. So these are they're community health organizations and they have clinics attached, but there are some other great private providers that provide infectious disease for clients who are positive as well. And that is it for me. So I'll turn it over to Miss Pamela Woods.
Can you hear me? Okay, I just want to make sure I'm muting myself. Not a grand introduction. I'm Pam. I am a very good friend of Gabrielle. I've known her for quite some time. And I'm just joining y'all tonight. I am a family nurse practitioner. I've been one for a while, and I've seen just about everything. When it comes down to AIDS, I can definitely relate to Miss Shalonda on her topic, especially in our community. I work currently at a clinic on Plank Road in Delmont Village, which serves an African American population for the most part, in an area where obviously it is underserved. And to kind of segue on what she was saying, she definitely was right about the syphilis thing, and also with the HIV exposure. I work with an older group of clientele currently, but I work with all ages. But what I am seeing with the older clientele is they are coming back positive for HIV, even in their older years, and a lot of cases of syphilis. And in most cases, they'll tell you they know they have it, but they seem to be very uninformed and very unconcerned. So that's where we come in. I know I like to spend a lot of my time, as a nurse practitioner. One of the big things about us is education, education, education. So I like to spend a lot of my time educating them on the importance of, not only, it's great that you know your status, but how are you going about taking care of yourself and preventing, exposing others to these illnesses, if at all possible, trying not to do that. So it is very common in our community. There are situations I'm finding, like I said, where people are actually aware of their status, but just, I guess, for lack of a better word, ignorance kind of comes into play where they don't really understand, the impact that it has on our community as a whole. So this is not something that's just in a younger population. It's very present even in the older population. And I'm speaking of people who are, anywhere from 60 and above. I even had a lady recently, this was like last week. I want to say she was almost 80 and tested positive for syphilis. So, it's very common. Please don't think, just as Shalonda was saying, the stigma kind of lies with, oh, you have to be gay or, younger, or a drug user. No, you don't have to be any of those things. In our population, you just have to be us. You have to be Black, uninformed, and it really increases your chances of exposure to diseases like this, such as AIDS and syphilis. So I'm just here basically just to offer any insight. If there's any questions, I want to encourage also people to realize that, the stigma that comes along with having AIDS and any other STD. Hopefully, we can work to kind of get rid of that stigma because just like Shalana was saying, you can live a long, healthy life. And the beginning of that is obviously becoming educated about what the disease process is, how it affects you, and how you can continue to live your life even beyond knowing that you have it. So I'm just basically here to answer any questions, to offer any support, and just for educational purposes. So if anybody has any questions, I'm more than happy to do my best to answer. If I'm not able to answer right offhand, of course, I can take the question and provide an answer for you at another time. But that's what I'm here for.
Okay, so with that being said, I have a few questions. I'm going to try to see if I can foster some participation in our chat, but if not, I think I have some questions that maybe some people may be thinking about. Okay, well, Stephanie has one. She says, "Can you discuss the latest medicine developments aside from PrEP?"
So, I mean, I know everybody's probably seen the commercials. You have, for instance, like Cabenuva, Biktarvy, Dovato are the most common ones. And the pluses with these medications is, of course, when AIDS, when they initially began trying to treat AIDS, it was, multiple antiretrovirals that these people had to take, which is obviously, I mean, that's going to discourage anybody from being compliant with taking the medication because who wants to go from taking no meds to taking multiple meds every single day? That's going to discourage you. So now we have really evolved. So now you're at a point where you can go and take one medicine a day and you're done. You've done your due diligence as far as treating your viral load and keeping yourself undetectable. Now, with that being said, it's great that we have those advances. But again, this is where education comes into play. It's not something to take and just utilize and think, oh God, I take the medicine. I don't really have to disclose to my partner, what's going on with me, because you're on the medication because you tested positive for AIDS. So you still have a responsibility to yourself, to your partner, and to your community, to not only be informed, but also to inform your partner of what's going on with you. But again, like I said, Biktarvy, Cabenuva, Dovato, those are medications that make it really easy to take, which increases compliance among people because they don't have to take multiple meds, and they don't always have to be seen by a provider constantly checking a viral load. But those are the newest advances, like when it comes to HIV medicine. So it makes it a lot. The big point is that it makes it a lot easier to comply. And if we can get the word out, if we can educate people, then they understand. It's just like anybody else, really, at a point now. I mean, whose family member, who doesn't have a family member that has hypertension? They take some sort of blood pressure medicine, at least one. You know what I'm saying? But it's a lot easier to get somebody to comply with one medication as opposed to 3 or 4 multiple times a day. So that's the newest advance in HIV medicine.
Yeah. We also have a question. Two people asked, what are some of the side effects that maybe you all have seen if individuals should choose to use PrEP? Are
So,
there any documented side effects of that?
so I mean, as with any medicine, there's always side effects. And the crazy part about it is that people will come to me and they'll say, oh, well, you're saying to take this medicine. I've even had a couple of people with the HIV medicines, but just medication in general, but HIV medicines that say, yeah, you see the people running around happy on the commercial, but the entire time you're naming all these side effects. It's like, well, I don't want to take that. You're lying. I mean, the people are walking around happy as all get out. They're doing flips, but in the background may cause suicide ideation, suicide ideation, but the most common side effects, as with most drugs, will be like some sort of GI discomfort. So maybe some nausea, some vomiting, like trying to become adjusted to the med. And it's not something everybody experiences, maybe headache. But that's about it. It's not really, you know, there's always an extensive list, but the most common ones tend to kind of lead in that area, like GI symptoms, basically. So it's not anything that's not tolerable, I would say, as opposed to knowing you have HIV and not treating it appropriately, and then it impacting your quality of life and ultimately the longevity of your life.
Okay. And this next question is for Shalonda and for Pamela. Does the patient or clinic notify exposed partners in newly diagnosed patients? Is there a legal requirement for that?
So, when when a person tests positive, they are, well, so when they test positive, the state does ask for all of their partners. And so they ask you to give the specific information, the partner, where they live, how long ago did you guys have sex, and those persons are notified. Now, we don't tell the person's information due to HIPAA, but those people are notified. And also, if a person tests positive, they're followed up through Louisiana Department of Health. They have to follow with them just to make sure that they are linked into care. So that's a big thing. So they are followed for 6 months until they are into care, maybe linked to a case management organization to ensure that they are taking their medication, they're going to their appointments. So if folks are notified. And if the person who does test positive, and just for instance, we had a newly diagnosed individual. She tested positive and she was so scared. She didn't want to answer the phone once she left our organization. And I told her, please answer the phone, because if you don't, they will come out. They will come to your home. So please answer the phone. I know this is new, but just answer the phone just to let them know that, you have been linked to your doctor's appointment. You are taking your medication. You are virally suppressed. So OPH does an extensive search to make sure that they are linked into care.
Okay. We also have another question. Is there funding or programs for medication? Because sometimes they were saying that maybe that can be a barrier. So, the financial implications of needing to take care of oneself.
Yes, ma'am. So as we were discussing last night a little bit about Louisiana. So it's funny, but it's not funny. And I tell folks, Louisiana is one of the most poorest, richest states when it comes to social services. A lot of folks in Mississippi, Arkansas, some folks on the lower parish of the lower Texas area coming to Louisiana because we have expanded Medicaid. And there's other programs too. Even if you have a privatized insurance, there's a program called LAHAP, and LAHAP is Louisiana Assistance for Health and Copays, I believe. And LAHAP pays for the medication. LAHAP pays copays and deductibles. So if you have private insurance and then your copay for the medication is $2,000, LAHAP comes in and pays the $2,000 to cover the client's medication. And they also cover the copay to go to the doctor's office if the client is experiencing a copay. But of course, with Medicaid covers 98% of everything. So whether the client has public insurance or private insurance, the state Louisiana does cover that. So a client who is positive should not be without medication in the state of Louisiana. You have those folks from the great state of Mississippi will come and find an address and you and access those services, because Mississippi has not expanded Medicaid. Texas has not expanded Medicaid. Arkansas has not expanded healthcare. So, and some of the governors have chosen not to accept Part D funding for LAHAP funding. So those individuals in the state of, I'm gonna just say, Tennessee, are trying to find ways, use copay cards to pay for their medication. So yeah, Louisiana does have a great assistance plan for those individuals receiving medications.
Okay. And so let's see, we have another question here. They said, with your experience and expertise, what unique challenges exist in treating pediatric populations? My chat moving faster than me. Okay. I like
Oh, I was waiting on you, Gabe.
Okay. What unique challenges exist in treating pediatric populations with HIV? And how do medication options differ for children compared to adults?
Um, as far as, I mean, with children, I think the challenge just becomes where you're kind of, what I've seen anyway is where you're dealing with the parents usually. Like, I mean, trying to get with the parent, or, making sure that the parent does follow through with the plan of care for the child. So it's usually a challenge, not so much for the children, but for the parents to actually follow through. Now, as far as, I have to be honest, that have to be a question that I have to go look at, because I've never experienced having to treat a child with HIV. So I'd have to actually look into that for you, but I don't have a problem doing that and getting back to you with that answer.
Okay. And leading into that, since we're talking about children, we have a question about, does PrEP have any effect on the fetus?
From what I understand, what I've learned from colleagues, it can have a potential effect on a fetus. So most definitely, if you anticipate, because PrEP is obviously for those, like Shalonda mentioned in her great presentation, that it's for those who are not HIV positive, but have a risk, a potential for exposure. So if you are in a situation like that, yes, I would definitely make sure, I follow up with my provider regarding, being pregnant, because it can have a negative effect on the fetus. I think even to the point where possibly, I guess it depends on what semester, trimester you're in. I'm sorry, trimester you're in, where it could actually harm you or cause some sort of, fetal death. So yeah, definitely. It can have an effect.
And so these two questions can kind of go hand in hand. Someone was asking about, a person being able to keep it to themselves. They said, is it a HIPAA violation to disclose another person's status? And then prior to that, we had a question about, basically, so a person who's infected, does they don't even get to know basically who infected them. So I guess that's kind of like a 2-for-1 right there, because it in that same space. I think, referring back to Shalonda when she was saying they do get the stats, but I guess it would kind of go with, do you know who your partners have been?
Right.
How many have you had?
And we encourage individuals who test positive to if when you decide to engage into a sexual relationship, to disclose your status, because then you're stepping from, we're just talking on the phone, to we're now engaged in a sexual relationship. But there is one thing that we talk about with the clients, HIV and the law. If you have a person that is positive, and we try to educate our clients, because some folks are weaponized with their status. So if you do decide, and now we understand that it's hard, you don't want to be judged, don't want to be stigmatized, but if you do decide to engage in a sexual relationship with a person, with another person or persons, educate them, let them know, because if a person claims that you did not tell them, or they say, hey, you infected me with the HIV virus, and possibly didn't, but they engaged in sex with you, you could be charged, one, with, still in the state of Louisiana in 2024, second-degree murder, or you could be charged with sexual conduct, sexual molester, sexual molester charge. So we do tell clients, a good thing about what's funded in the state of Louisiana, Crescent Care Legal Services, they have Part A funding where they provide legal services for clients who are positive. And we encourage clients to say, if you want to bring in your partner, that they can sign an affidavit saying, I, Sally Mae, informed my partner, John Paul, that I am HIV positive, just as a security to say, hey, I did disclose this to you. Because, we had an individual who was positive for a long time, and he was going with this young lady. She got mad because he cheated on her, and she was actually coming into the office with him. And once she found out that he was cheating, she went to the police office, the police department, made a claim that he did not tell her. He was in the newspaper, he was charged with sexual misconduct, and it was just a mess. So we just try to teach clients about HIV and the law because it is very important.
And I mean, I guess like that's just the kind of, I mean, that's the whole reason like we're here, having this evening is to really just kind of help take away some of the stigma that's associated with this. This is not, just like Shalana said, this is not 1980, where, when AIDS first was put out there, it was a death sentence. And people were literally so frightened. They were doing some really strange things, kind of like to the equivalent of some of the strange things we did, in COVID, that you look back on like, now, what was I doing? So, I mean, it's really, this is really here, Shalonda gave really good information about, especially in our community, us, how we are impacted, how we are affected. This is to take away the stigma of this. This is not, to place judgment on anybody or, whatever your lifestyle choice is, however you live, but it's just to make you fully aware that you no longer need to feel as though it's a death sentence. It's nothing to be ashamed of, that there are professionals out here and resources, just like Shalana was talking about, that are here that can assist you and help you live the best quality of life possible. It's not a death sentence and it's not anything to be ashamed of. Of course, if you would prefer to keep your status to yourself, that's absolutely fine, but also be smart about it. And if you're going to engage in a sexual relationship with someone else, be a responsible adult and share your status with them. Move on, treat somebody the way you would want to be treated. So we just want to encourage you here to not be afraid to seek help, to not be afraid to ever have a conversation with a partner saying, hey, look, what is your status? And just like Shalana says, not, oh, I brought you a paper and hey, look, you can see on the paper. And then when you go in and see your provider or your physician, nurse practitioner, whoever it may be, I know even for us, a lot of times we offer this testing, but if it's not offered, it's okay to ask for it. I mean, I've been tested myself on more than, one occasion. And I can tell you, I live the average lifestyle in a monogamous relationship. But again, like Shalana says, that doesn't mean anything.
Right.
Doesn't mean anything at all. I asked to be tested times before. It's been offered to me in the past. I know we offer to our clientele. We will offer to test you. You have a right to know, and also a responsibility to yourself to know what your status is, what's going on with you. It's not just going to the doctor anymore and know if you're diabetic or know if you have high blood pressure, know if you have a kidney function problem, or know if there's something wrong with your liver. No, you need to also know if you have, what your status is with STDs, for sure. You owe it to yourself. And again, to just put the point out there, we got to get rid of the stigma. So we're all here. This is an open session where we can have fluent conversation, just about anything, any question you want to ask. We just want to encourage you to become as educated as possible and know that, this is not a death sentence. There's no need to feel so ashamed. People are living their lives every single day with an HIV status, a positive status, and living a normal life, going about having a great quality of life and doing great things. So that's what this is really about.
So we have a few more questions and I don't want to keep you all too long. So I'm going to go from the bottom up. And I think this is a great one. When should we discuss this information with teenagers?
Early.
Right now at this very moment.
Whatever
the age, the way that they have access to social media, I mean,
yeah,
it's pretty early on. Like these kids it'll shock you, 8, 9 years old, so I guess it really all depends on, how well your child best. Okay. What sort of relationship you have with your child, your child's, maturity level, the education level, whatever it is, their ability to understand that level. I would play that on a case by case. You know what I'm saying? But I would say as a general rule, approaching middle school at somewhere around 10 years old, it's probably a good place to start having a conversation about just things in general before you even get on that, that spiel with them. But I think it needs to be approached, on a case by case basis. But Shalonda knows about a lot about that too. So
I would say,
Yeah.
I would say you can lead up to age appropriate conversations for when the child is matriculating to specific ages, because we are testing a lot and how we are having a lot of high school students testing positive for syphilis. And I just thought that was crazy, but now it's trickling down to middle school students coming in testing positive for syphilis. And when we do this, we do the all panels, but luckily we're not really seeing individuals testing positive for HIV. But syphilis is a hot spot right now.
oh
So
yeah, it is.
And
so I
so I
think
just looked in the chat. Look, ladies, and they said, one of our ladies in the chat said a discussion should be had as early as the age 11 because a
mhm.
student can be treated for HIV at the age of 13 without a parent's
Yeah,
consent.
without parental consent. So yeah, I was
Okay.
just about to say that. So yeah, so and we do have students that when we do community events, or we do large, huge community events, they'll pull us to the side and say, "Hey, can I get tested?" And parents don't kill us, but this is the state law. We don't have to disclose this to parents. They don't. They can get tested at 13 without a parental consent.
Okay.
So yes,
And
ma'am.
I definitely want to it's two more questions that I do want to approach. We can kind of combine one. One was in reference to basically mental health or counseling or other resources that are available. And is Family Services of Greater Baton Rouge the only place that offers this whole kind of wheelhouse for these services?
No, we're not. So like I said, Ryan, so Baton Rouge has our office. This office through the so we're granted through the Ryan White funded grant. And so Ryan White, the main office is located on Plank Road, is through DHDS. And so the main Ryan White office is there. So there's maybe like six or seven providers. The Lake is a big provider who receives Part A funding, not only case management, but they do the medical funding. Care South Family Medical and Dental, Open Health Care Clinic, they provide these fundings. VOA, Volunteers of America, Family Service, and did I say Care South? I believe Care South. And so
Mhm.
and this is just Ryan White funding. Like I said, we work with a lot of great non-Ryan White private providers. So it's a whole big scope. The only difference is with Ryan White, it gives us a little bit more leeway to be able to pay for things that necessarily you can't get at your doctor's office. We provide financial assistance for housing, like just to eliminate those barriers: housing, food, transportation, um, um, insurance. We have benefit specialists. We have we also have peer services, persons who are living in the experience of HIV. And when they come in, you have persons who are coming in who are newly diagnosed or who are not adherent or compliant with their medications. We have peer services, which is our early intervention services. And the peer will say, "Hey, I'm positive. I've been living with this. I'm an advocate. I've been living with this a certain amount of years. Look at me as an example." Um, so I would say that's the difference. But like I said, it's Baton Rouge has a good collaboration between private providers and Ryan White providers.
And we actually have a question from Facebook. They said, "Do you know of resources available to speaking to youth about HIV, AIDS, or STIs in general?"
Speaking to me directly or anyone?
You are either Pamela. They just kind of want to know where can they go to get information if they want to get some of those
Yeah, I
community
can provide
outreach.
my email in the chat if you would like. If
Yeah,
you
give me your
guys,
email, Sean.
it's sbradley at fsgbr.org.
See if I can put it on here. It's Bradley
Mhm.
at. Give me those last letters again.
FS Family Service, Greater Baton Rouge, fsgbr.org. And I'll put it in the chat.
All right, all right. So, I don't know. Ernice, do you have any other comments for us this evening? I wanted to keep everything to roughly about an hour, not go too far over that because I know that the time is getting late. So do you have any additional questions or commentary for our guests who are panelists here with us this evening? Let me see if Bernie's considering. Wait, let's see. We got something else. Okay. They said you guys were awesome. They really enjoyed this activity this evening. And I just appreciate you giving us your time. And there is Ernice right there, our beautiful chapter president. Would you like to chime in for us?
Oh, I want to thank you all, our two panelists, Ms. Woods and Ms. Bradley, so much for your knowledge and your insight this evening. It was very informative. I was following along with the chat. I actually turned my video off because I was starving. So, so I stepped away for a minute, but I, listening in the background and whatnot. And so I just want to thank you all again. We know that, informing our community with the information that you provided to us helps us be more knowledgeable and to go out and let others know. And I think, even though we honor World AIDS Day, during this time period, this is worth a continued conversation or even other topics related to this. Especially, I saw a lot of comments about, STDs and just general medication stuff. And I know that we're not here to provide any kind of medical diagnosis, but sometimes you just got questions, And so, maybe this is something that we can get back with our committee and maybe have some ongoing kind of dialogue and conversations about various topics that are of interest to our community. So again, we just want to thank you. We appreciate your time and your energy this evening. We want to thank the guests here on Zoom, as well as those who joined us virtually via our streaming platform on Facebook. And again, check us out at brsigma.org to learn more about the programs and the activities that we do.
They wanted to get
Can barely hear you.
they wanted to get can you hear me now?
A little bit better.
A little bit better. Okay. They wanted to get some of their input on the pending lawsuits of Truvada and some of the other medicines and how they're impacting people's kidneys. And I didn't want to leave that question behind. So, do you all have any opinions about it?
I could barely hear you, Gabe. I heard something
All I
about
heard is about pending lawsuit. That's all I heard.
Yeah.
I don't know.
Yeah.
I will email you.
Okay.
I'll email you.
Okay.
All right. Thank y'all. Good night, everybody.
All
Thank
right.
you.
Good
Thank you
night.
very much.
Thank you.